If you see a bit more purple around this month, there is a reason for that. June is Alzheimer's and Brain Awareness Month. Today we have Pam Myers with Alzheimer's Association in Northwest Ohio with us to talk more about why showing support for those affected by the disease is so important. Pam, great to see you. Welcome. Thanks for coming in today.
Thanks for having me, Dan.
Let's start off with the difference between dementia and Alzheimer's, because there is a difference, and a lot of times it's kind of a blurry thing.
It is. And you know, Dan, when I'm out speaking, that's the #1 question I get asked. What's the difference? So if you think of dementia as the umbrella term, like a term like heart disease, it covers all dementia. We actually, when we do graphics, we show a picture of an umbrella. Alzheimer's disease is the most common form of dementia. It accounts for 70 to 80%, depending on whose research you read, of the dementia cases. So we really think that's why people interchange those terms, Alzheimer's and dementia. But Alzheimer's disease is a type of dementia.
Yeah, and really Alzheimer's can strike even people in their 50s and 60s and 70s way too early.
Yes.
Dementia can happen more in terms of like people in their 80s and 90s, so an age-related type thing.
Absolutely. We know that about 90% of all dementia cases are in people over the age of 65.
What's scary is that in these numbers here, Hispanic Americans are 1.5 times more likely as white Americans to be living with Alzheimer's or dementia. African Americans twice as likely. Just a stunning number there. Any theories out there why that is?
Well, we're doing a lot of research, Dan, to try to figure out why that is, why those populations tend to be more affected. You know, a lot of research hypotheses are built around, racial discrimination, lack of access to good health care, healthy foods. So access, socioeconomic factors, that's where a lot of the research is headed.
The drugs are still out there. There's not a cure for it yet. They're finding some reasons why. I know that they've done research. They see like evidence of plaque in the brain. If they can find that at a younger age and see traces of it, that would be great. Are we making progress in that category?
We are. One of our biggest thrusts here at the association is early diagnosis, early detection. So we really are encouraging people to, if you're noticing changes in yourself or someone that you loved, memory changes, behavior, mood, whatever, that you really get into your healthcare provider and get checked out, because these medications, as you said, are only effective in the really early stages of the disease. But what they're designed to do is stop or slow down the progression of the disease.
What your organization in Northwest Ohio, what is your, other than awareness, purpose? Are you working with people possibly in getting to the doctors or getting a network of doctors available, or putting people together with common issues to talk about it?
We sure are, Dan. What we do, what we offer here at the local chapter, we have education and awareness programs. So I had a call today on my voicemail, somebody looking for information about the disease. They had been in to see their doctor. They're working them up for the diagnosis. So they wanted to reach out and learn more about the disease. We have caregiver support groups. We have activities for people living in the early stages. We have a care consultation program where we help people along the journey. All of these programs are free of charge to our public.
It has to be a diagnosis that's so hard to hear when you're a family member, because it's going to mean a change in the behavior of the person. It's going to change your life in trying to keep them manageable, happy, and try to deal with that and then find a way of solving the problem. What do you see every day?
We see families who are doing the best they can. We see some families who are trying to get ahead of the game a little bit, plan ahead. We see other families that maybe live in denial a little bit, and so a crisis happens. Mom or dad wrecks the car, they get lost. They don't recognize someone that normally they would recognize. So sometimes those families are thrown into crisis and they have to make decisions quickly. So another benefit, if you will, of working with us sooner is helping people plan and to prepare what's coming. This is unfortunately a progressive disease with no cure. So how can we best support those family members, those caregivers on the journey?
10 healthy habits. So just talk about ways you can prevent, if there's any way of doing. I think being active probably helps.
Yes.
Eating right, taking good care of your body. physically and mentally as well, but what habits are good for that?
So let's talk real quickly about my favorite habit to avoid, which is smoking. No smoking. But everything that you mentioned, Dan, eating a healthy diet, maintaining a healthy weight, keeping your blood pressure down. So think about all the ways you take care of your heart. Those are the same way you should be taking care of your brain. Keeping yourself mentally active, learning a new skill, and then of course protecting your head. So if you're a cyclist or a boarder, a rollerblader, wearing your helmet, protecting your head is also important.
I want to mention there's a walk for Alzheimer's coming up in October. There it is, October 18th. Want to make sure you know about that if you'd like to walk in that and raise some money for Alzheimer's Association. Also, the information to get a hold of the Northwest Ohio chapter right there, 1-800-272-3900. Their offices are in Maumee area. So, Pam, thanks so much for coming in today.
Thank you for having me.
Appreciate it.